words Planned Parenthood, many of you might automatically think about an organization that came into the spotlight in the 1960s and 70s. But what exactly is Planned Parenthood in the 21st century? This organization has become the largest single provider of reproductive health services and sex education in the United States. Today, we would like to explore the many unknown services that Planned Parenthood offers. I'm Jenny Robinson, and with us today is Director of Education for the Pacific Southwest Chapter of Planned Parenthood, Chrissy Smorek. Chrissy earned a bachelor's degree at Wilmington University in behavioral science and is presently working on her master's in marriage and family therapy at Touro University. She's worked in reproductive health since 2004 and is a trainer for the state of California and an adjunct professor at San Diego State University. Welcome to PACE TV, Chrissy.
Thank you.
I am so glad that you were willing to come in today to talk to us. I know you're very, very busy, but we have a lot of information to give out today.
Absolutely.
So let's begin with the history, just a short history
Sure.
of Planned Parenthood, because I think a lot of people don't know it.
Absolutely. So Planned Parenthood, we can trace our roots back to actually 1916, where Margaret Sanger and her sister Ethel opened up the first what we call early health center, but at that point it wasn't a health center, in Brooklyn, New York, that was strictly giving out information and advice around contraceptive methods. They were only open for about 9 days and then they were shut down, but Sanger continued to tour the country giving out information, education around birth control methods. In 1923 is where our first health center, we can trace our actual health center to open, and that was providing just birth control methods.
Where was that?
This was in also in New York.
Okay.
Our affiliate, so there's 56 affiliates across the country. Our affiliate is San Diego, Riverside, and Imperial counties, and we opened in 1963, actually as an educational booth in Balboa Park.
Wow.
Yes.
So you've been around here for a long time.
Yes.
So what is the mission of Planned Parenthood?
Yes, our mission is to ensure broad public access to reproductive and sexual health services through direct services, education, and advocacy. We call that our three-legged stool. We can't have one without the other. So our services we provide in the health center, the education we provide in the community, as well as the advocacy that we provide to continue to make sure that everyone has access to compassionate care and comprehensive sex education.
Right, and when you say everyone, you mean everyone. You mean men, women, old,
Yes.
young?
Yes, absolutely. Men, women, our transgender community, non-binary, old, young, college, not in college, rural, city, it doesn't matter. We want to make sure that everyone, regardless of where they live, who they are, have the same access to quality care.
That's great.
Yes.
So you're not just in the United States.
No, we're not. We are arm of our global services called Planned Parenthood Global, and we actually don't operate any health centers, Planned Parenthood health centers outside of the country, but we do partner with many local organizations, mainly in Africa and Latin America, and we work with them to help them establish sound reproductive health services, to advance their advocacy missions, to help them with their funding sources, and through this, each year about 2 million people are served globally through these services. And I think it's about 300,000 are reached through education.
So you have classes for people, say in a country, Chad or whatever, in Africa,
Yes.
and you do have your people go over there, or do you just train them, or how does that work?
So our people, the Planned Parenthood folks, will train local local members of that community. So whether it's in Africa or again Latin America, and help them with training, education, resources that then they can provide in their own community. So we're empowering other local organizations to provide this work to their members of their community.
Right. So about how many people do you think you serve then?
So, well, globally it's about 2 million through services and about 300,000 through education. Locally, nationally, I should say, for Planned Parenthood, we see about 2.5 million people through our health centers each year. And at our affiliate alone, that is about 130,000 through medical services and 40,000 through educational outreach.
You mean this area of the country has that many people?
This our affiliate alone. So
Wow.
San Diego, Riverside, and Imperial reaches about 130,000 through health center visits and 40,000 through education.
Wow. So you keep track of all those numbers of people coming
do.
in the door.
We do.
And so what is the range of age?
Sure. So the majority of our age range is between 18 to 29. So I think there's some misconceptions that Planned Parenthood serves very young patients,
Right.
and it's really that right out of high school, college, young professional age range is the majority of our patients. About 4.5% are patients under the age of 18, and it's about 1% over the age of 50.
Oh, so very small percent over 50,
Yes.
but you do get some.
Absolutely, yes, for sure.
Okay, and the oldest person that's ever been in this
Oh
series?
goodness, I don't have an actual age,
Yeah.
but I can say that specific health centers, depending on where they're located in our communities, do see different demographics.
Mm-hmm.
So our health center in Escondido sees an older population, more in the 40s, 50s, whereas our Mission Bay Health Center will see people more in that college range.
Yeah.
So depending where our health center is located, we do see different demographics.
Right. Now, you have not just got birth control. You have a lot of
Yes.
services. You go on the website. What's your website, by the way?
www.planned.org.
Great. They list all types of services. So can you just talk about those?
Sure. Yes, there's a lot. There is contraceptive methods, which include all FDA-approved methods of birth control. We do testing for sexually transmitted infections, and this is for people regardless of their sex or gender, as well as treatment. We provide rapid HIV testing, so a person can find out within 20 minutes the results of their HIV test, where in past they would have to have a test and then go home for 2 weeks and then come back to the health centers, which you can imagine causes a lot of stress, but also if there's issues of transportation or access with barriers to access. We also provide infection testing, and this includes males as well, so testicular cancer screenings, urinary tract infections, yeast infections, so we do testing and treatment for all of that. We provide pap smears, cervical cancer treatments, so if somebody does have an abnormal pap and they need treatment, they can get that treatment at Planned Parenthood. And then we provide a lot of referrals out for mammograms, for prenatal care. We provide abortion services, and that's surgical and medication.
Okay, so and again, that is for men and women both.
Yes.
And so you have, by the way, the HIV screening, did that improve over time just because of medicine improving, and now you can do it in one day and you don't?
Yes. Yeah, so technology improved
Yeah.
that we are able to do it all in one day, again, to eliminate a lot of barriers that people were having. And it also improved the testing. So the previous testing that we've done tested for the antibodies, which could be a 3 to 6 month window when somebody's been exposed to when they would test positive.
Ooh,
and
I
in
see.
that time, they could be highly contagious, so they could be passing on an infection that they're not even aware of.
Right.
So now the tests that we have now is actually, it's called the 4th generation, and we can detect as early as 2 weeks after exposure.
Wow.
So there's been a lot of improvement
Really?
in medicine that has been really beneficial for our patients and our communities.
Yeah, and you said irregular pap smears can be treated there. That's
Yes.
quite a long procedure, a process.
It can be.
But
It
you
can be.
you have enough medical facility. It's a clinic, isn't it?
Yes, yes.
Okay.
We have 17 health centers located just in our region alone. So we do have enough facilities where we can care for our patients if they do have an abnormal pap, that we're able to provide further testing to determine why that is, and if it needs to be treated, that we're able to do some of those treatments in-house in our health centers.
Okay, so you have doctors?
We do. We have doctors, nurse practitioners, physician assistants, amazing medical assistants as well.
Great. Can you talk about where your clinics are in San Diego area?
Yes, so they're spread out. So we have in Kearny Mesa, in Mission Bay, Escondido, Oceanside, downtown. We have many. Then we have more located in the Riverside area as well as in Imperial Valley.
Okay, yeah, I bet that's a big area. There are a lot of underserved people in that area.
Yes.
So on STDs, is there any increase in STIs or STDs, sexually transmitted infections, that you've seen lately?
Yes, our country in general, including California, including San Diego, are in an epidemic for sexually transmitted infections. All infections have increased rapidly over the past several years, and that is across the board. We do see higher infection rates in young people under 24, but we are also seeing this in all populations, including the senior populations.
And why do you think that is?
There's a couple different theories. One is dating apps that now make it easier for people to connect and go on dates and meet people than it has been in the past. There's also been other advancements in medical technology to make sex possible and pleasurable in later years. And there's also a lack of sex education that a lot of people over 50 did not receive when they were in school. So when you have these opportunities and coupled with lack of education and awareness that infections are even a problem and how to protect yourself from that, that's where the increases come from.
Right. So it just shows you the importance of education, doesn't it?
Yes, yes. Where we see education in our country, where we have seen comprehensive sex education, we see better outcomes for young people in regards to STIs, sexually transmitted infections, as well as unintended pregnancy. And we see higher ages of first actual sexual activity.
Now, do you have any connection at all with the sex education that kids get in junior high and high school?
Yes, yes. So we work with many of our local school districts to help them provide the comprehensive sex education that their students receive. So I myself actually train a lot of teachers across San Diego and Riverside on how to provide comprehensive sex education in the schools. And then we have a team of educators that go in and provide presentations on anatomy, birth control, STIs, as well as healthy relationships, consent, boundaries, communication.
And drug issues?
We do, yes. We do talk about substance abuse, specifically sex under the influence as well as the boundary issues that people may have when, and risk reduction with substance.
Is it government required to have sex education in schools now?
Sure. So in San Diego, or excuse me, in California, yes. So California passed the California Healthy Youth Act a couple years ago, which mandates that comprehensive sex ed must be taught once in middle school and once in high school. And what that
only once.
Only once
in 4 years.
Yes,
Okay.
yes.
Okay.
What that means with comprehensive is that it must be free of bias. It must be available to English language learners. It must include all methods of birth control, as well as discuss all ways that STIs are transmitted and how to protect from STIs. It must also talk about boundaries. It must talk about consent, body image, human trafficking, as well as other social issues that a lot of young people face these days.
So that must have to be updated a lot,
Yes.
because that's sure different than when I learned about it. So is there a group that meets to decide how that's going to work?
There are standards that are put forth for the state, the sex health standards, the education standards that discuss what must be taught, what are the best areas to teach those topics in, and they're updated as the information comes forward or annually.
Wow. And I'm sure you have representatives that are in on that. And is it usually a science class?
Yes, they're usually, especially in high school, it's usually in science class. In middle school, sometimes it will be, if they have life skills, very rarely do schools have health classes anymore, mandated health classes, but sometimes it will be in those classes as well.
Okay, so can you walk us through a typical patient coming in, you call them patients?
Yes.
Okay. And what happens to them when they walk in the door?
Sure. So a patient, once they make an appointment, or if they walk in, usually they'll make an appointment, they'll come in and they'll be greeted at the front desk where they're giving information about their rights, specifically around privacy and HIPAA, as well as—
What's HIPAA?
Oh, HIPAA is the federal policy for protection of medical information. So to say
privacy.
Privacy, exactly. So, and then they're also given some information about funding if they need funding through insurance. So they'll receive that information then.
So they have to fill out a form that proves they can't pay the full amount and they get a discount.
So they'll fill out a form that either shares their insurance information, because we do accept most insurances. If they have a barrier to insurance, or if they don't have insurance, they'll fill out a form for Family Pact, which is specifically for California program that started, I believe, in the 1970s, and it funds all reproductive and sexual health except for if a person's pregnant. So it funds birth control, STI testing and treatment, pap smears, treatment for cervical cancer. Basically, it covers everything reproductive-wise except for prenatal services and abortion. So
prenatal is not included.
It's not included.
A little strange.
The program was designed in the 70s to be a pregnancy prevention program. So I believe it first started with just covering birth control, and then started expanding its services from there. So that's where it was developed for, is pregnancy prevention. Right. So more of a prevention sort of program. Yeah. So they'll fill out those forms. They'll also figure out a code, like a 4-digit code, that is their code to access services. So they have to go online to find out their testing results, or if they're calling to make an appointment, or if we need to call to verify any information or give results, we use that code as well to protect privacy.
So that's great that they can just go online and find out. They don't have to come back in.
No. So and again, for HIV, they'll find out right there and then in the health center, but for abnormal PAPs or testing for chlamydia or gonorrhea, which are two very common sexually transmitted infections, they'll be able to find out online. We also would have a case management nurse call them as well to follow up on their treatment.
So how many case managers do you have?
Goodness, I'm not sure the exact number, but there are many, but we could probably use a lot more.
Yeah, I'll bet. So then what happens as far as follow-up?
Sure. So depending on their service that they received that day, they may need follow-up. So if they have an abnormal PAP, or if there is a positive STI like chlamydia or gonorrhea or syphilis, case management would be the ones to reach out to schedule additional services, follow-up treatment, and they'll work with that patient and their schedule to make sure that they get back into care.
Okay, and so that could include counseling.
Definitely. All of our patients that once they have filled out all their paperwork and they're brought into the back office, they see the medical assistant first, who collects all of their vitals as well as their medical information, and then can also provide some birth control counseling, pregnancy test and options counseling, as well as education. And if further counseling is needed, we have a wonderful referral list, and we partner with many fantastic organizations within the community to make sure that our patients receive holistic care.
And so this would be specifically also for gay and lesbian, that just young boys or girls that are just discovering who they are, and they need counseling because mom and dad don't understand.
Yes, they might need somebody to talk to process, to talk about how they can come out, in a safe way. So we partner with the center for additional information and for people to have somebody to talk to so that they might not feel as alone, and to really be the experts on those topics. As well as we partner with our sexual assault and domestic violence organizations to make sure that our patients that have been assaulted, whether that's why they're coming in or if this happened in the past, that they're receiving the care that they need.
Right, which might take quite a few follow-up meetings.
Definitely.
Now, you are a teacher for teachers, but you also teach a class at San Diego State.
I do, yes.
And so tell us about that.
Sure. So I teach human sexuality at San Diego State University, and it's very exciting. We talk about many different issues, obviously anatomy, contraception, STIs, but we do this through the reproductive justice lens, where we look at intersectionality between social justice issues and how it can impact a person's reproductive and sexual health. So we talk about barriers like transportation, access through different laws that are put forward. We talk about the silence and shame and stigma model and how that can lead to people to not get treatment. So we really unpack these issues and look deeper into them.
That's great. And this would be for future people that want to work in the area, or is this just for people that really want to learn about what's happening?
It's a little bit of both. Okay. It's a public health course, so many of the people that are taking this class are public health majors. So a lot of students want to go into the medical field. Maybe they're not quite sure what that looks like yet, and this is their time to really discover that, but usually people that are going to be working in the medical field.
And I understand it's a big class.
It is. I believe the last time I checked, I have about 85 students right now.
Let's talk about human trafficking.
Sure.
I know that this has become a serious issue, and it's been especially big in San Diego for some reason. I don't know, is it equally as bad in every other city?
No, San Diego has been determined to be a hotspot by the FBI for human trafficking.
Because of the border.
So that could be one reason for it, but what we actually see specifically for sex trafficking is that it is more domestic, so within the city. And it's usually between people that are using manipulation, using the promise of love and affection to draw someone in, pretend that they're their boyfriend, buy them pretty things, nice things, give them a lot of attention, and then we'll ask them to do certain things for them and really lead them into this life of sex trafficking. For other trafficking, like labor trafficking, yes, I believe the border is definitely a factor in that.
So this is mostly women?
Mostly women. When we talk about sex trafficking, yes, mostly women and young people.
How young?
Under the age of 15, 16,
Oh,
sometimes
wow.
even prepubescent.
What would a leader of a trafficking group be called?
Pimps are
Pimps,
usually
right.
the people that actually will have these people work and collect the money and instill violence or manipulation, fear into that person.
Yeah.
Usually we see this in San Diego. It's mostly done through gangs. And again, it's mostly domestic. Recruitment's done at high school campuses, usually by other women that are victims of these organizations, of these pimps that are alluring by befriending, by saying, hey, I have this great person you should meet. I think you would really hit it off. And then again, these predators prey upon these people wanting love and affection. And what young person, what adult doesn't want somebody to be nice to them and to tell them that they're wonderful and special, and using that form of manipulation really indoctrinate them into this life of trafficking.
And so they're among us now.
Yes.
And they might show up in your doorstep. Now, why would they come there?
For testing for sexually transmitted infections, pregnancy testing, birth control, could be many infection checks.
And you mentioned an example that you had of a girl that did not even realize that she was being used for that. Can you tell us about that?
Sure. So there was a young woman that came to one of our health centers that just got off the plane from, I believe it was Michigan, but I'm not quite sure on that, but just came off the plane from somewhere outside of California and was brought in and was getting tested, and through talking with our medical assistants and our clinicians, it didn't sound right. Something seemed off. She met this gentleman online and said promises of a future in acting and modeling, flew her out here against her parents, without her parents actually even knowing, and was bringing her in for testing. We recognize those as signs of really grooming somebody for sex trafficking. So immediately we had the young person call her parents first and foremost so that they would be aware that their daughter was safe. And we called law enforcement. And we kept the woman there, the young woman there, until law enforcement came. And we actually also saw her back to the airport and made sure she got on that plane safely.
And were you able to get the pimp?
Was able to apprehend, because all of this was happening while that person, the perpetrator, was in our waiting room. So that's a reason why also we always see patients alone by themselves, because we don't know the relationship that they have with the person that brought them.
And you had to sort of figure out what was going on, and she didn't know.
Yes.
It's amazing.
And that's through training. We receive training every single year on how to recognize signs of human trafficking, how to recognize signs of intimate partner violence, sexual assault, and what we should do from there. What is our legal responsibility, but what's also our ethical responsibility.
Right. That's good. I'm sure that's a very fine line.
It is. Sometimes it can be really difficult to determine. So thankfully, we're able to reach out to law enforcement to say, hey, I'm not sure if this is a mandated reported situation, or I'm not sure what to do in this situation, and they're able to provide support. We also partner, again, with amazing organizations in all of our regions. San Diego.
Like what ones?
So the Center for Community Solutions is one here in San Diego that we partnered with them for actually several years to really make sure that our screening for intimate partner violence was compassionate, that it was shame-free, and that was effective. It's very different to look at the computer and type in and ask someone questions without looking them in the face about violence, rather than sitting down with them, looking at them, having a conversation, showing that you care. So making sure that we are doing it the right way for our patients. And then also making sure that when we do have a patient disclose any type of abuse or violence, that we're able to give them a warm handoff to an organization that we trust. It doesn't feel good to say, hey, here's a phone number, give them a call. Instead, we can get on the phone and say, hey, I'm talking to Chrissy over at the Center for Community Solutions. This is her number, or here, let me hand the phone off to you.
That's great.
So we want to make sure that our patients are taken care of. And a lot of times they're coming to us and this is the first place that they're disclosing this information. So we have a responsibility to them to make sure that we are seeing it through.
And you also mentioned that you go to jails.
Yes.
So tell, and down in, you someplace else too, you do, you go reach out to all these other areas that people don't know about.
Yes, so we provide sex education, many different areas. So we talked about schools, we talked about colleges, but in the correctional system. So we are at the women's jail here in San Diego. We go to all the juvenile justice places throughout San Diego and Riverside, so juvenile halls. We are in drug and alcohol centers. We provide education for people with varying abilities, so physical, developmental, intellectual. That's a population that a lot of time is left out when talking about sex education. And it's also a population that is preyed upon by sexual predators as well. So we talk about sexual safety, appropriate boundaries, appropriate touching, things like that.
That's great. Well, Chrissy, I could just keep on going for hours here. You have so much information for us. I really appreciate it. And I certainly hope that Planned Parenthood has a strong future and gets support. So we'll put that website up one more time.
Absolutely.
And thank you so much for coming today.
Thank you for having me.